So cannabis is a pharmacological agent, has been used for centuries. It's been described in China and Asian countries dating back to well before the BC era. And over time, it expanded into the 1800s into Europe, where a physician used it for some pain purposes as well as some other purposes as well. And ultimately, it made its way to the United States, where it actually made itself available to patients until it was ultimately outlawed in the 1930s and 40s. And now, obviously, it's making its comeback now in the hopes that we can use that as an option instead of using opioids. So the jury's still out on that. Unfortunately, the studies in medical cannabis, because it is still a Scheduled I drug, are very difficult to do. And so we just have a lot of anecdotal evidence and some studies which do show that it has some benefit in pain management, specifically in neuropathic pain conditions such as multiple sclerosis. So there are some studies showing that as a population it may decrease opioid use. There's also some case reports showing that in specific patients, opioids have either been significantly dropped or completely stopped. There's a couple of patients, for example, that had chronic lower back pain and multiple sclerosis that were on over 300 milligram equivalents of morphine in the past, and they have been able to reduce their dosage and even stop their dosage at those high levels using medical cannabis. The two main constituents that are thought to produce most of their pharmacological activity in terms of pain management are cannabidiol and THC, but there's well over 80 other compounds which may or may not have an effect. Unfortunately, we haven't been able to study any of those yet. Unfortunately, in order to study these drugs, you have to go through a very complicated process in order to get approval to be able to use them in clinical trials. As states have become where it's become legal, it's become easier for patients to get it, and it may be a little bit easier to do outcome studies and basically following those patients along and see how they do. But in terms of clinical trials where you assign a patient to a cannabidiol or THC, that you do need a lot more legal requirements to fulfill. So for primary care, what I would say is, in terms of using cannabinoids as a treatment option, it may be at the forefront of your mind to kind of consider that, especially before you start putting patients on opioids. Opioids, for example, once you start them on opioids, if they've been on it for a couple of months, chances are they're going to be on it for the rest of their lives. And so with medical marijuana, that may be an option where we may be able to provide something else to patients and hopefully decrease the use of opioids for chronic non-cancer pain.